had collapsed lung back in 73. Yeah, 73. And they told me then that I had symptoms of emphysema. They kept stressing that I'm going to have to quit because otherwise I was just killing myself.
I mean, I don't think there's anything more frightening in this world than not being able to breathe.
But they tell me that I've only got so much, I've got very long to live. I'm terminal. I can't say how long I've got to live. Only God knows that. But at the most 6 months.
Those comments are from former cigarette smokers who had smoked between a pack and a half and 2 packs a day for 25 to 35 years. They stopped smoking either because they couldn't breathe or because lung cancer was killing them. And remember the Surgeon General's report of 1964? Because of that, cigarette ads and packages contain a warning label. It reads, quote, "Warning, the Surgeon General has determined that cigarette smoking is dangerous to your health," unquote.
Right after that report came out, there was a decrease in the amount of or number of cigarettes consumed, but gradually since that report, cigarette smoking has again increased. The statistics are produced by the American Cancer Society in magazines that they send out, and they show reasonably clearly in their statistics that lung cancer, for example, will soon pass breast cancer in women as a cause of death. It is already double any other cause of cancer death in males, and the rates are still climbing on both. So that in males, all cancers are the second leading cause of death, and that lung cancer is by far the greatest. In 1980, it is estimated that 34% of men, will die from lung cancer, of all those that die from cancer, and that women, 14% will die from lung cancer, of all those women that die from cancer. And cancer is the second leading cause of death in the United States.
What about the 86-year-old guy who has been smoking since he was 12 and seems to be in fine physical shape? What incentive is that for other people who are smoking to quit? They may say, gee, I can keep on smoking and be just like that guy.
It wouldn't give a younger smoker much incentive if he chose to rationalize his smoking that way. But the older gentleman is just lucky. He does have emphysema because in a study done on patients that have died, all smokers have emphysema.
Seniors in a U.S. government class at Grandview Heights High School all knew the hazards of smoking, but were divided on the issue personally.
It's bad for your lungs, especially. I've had pneumonia twice in the past 3 years.
Are you a smoker?
Every now and then. I've been trying to quit, very much so.
But you haven't quite quit yet.
Oh, I'd say I've cut it down 99%.
How much do you smoke?
Right now, maybe a couple cigarettes a week.
Just that it's bad for your health, about everything that you heard from, cancer and whatever.
Are you a smoker?
Nope.
Have you ever smoked?
Yep.
For how long?
Oh, probably 2 years.
How much?
Off and on, just with friends, mostly because of peer pressure, whatever.
It's bad for your lungs and for your overall health.
Are you a smoker?
No, I'm not.
Have you ever smoked?
No, I haven't.
Are you planning on it?
No.
I know it's just bad for your health, and it costs a lot of money, and it smells, and it's bad for other people when you smoke in front of them.
Stunts your growth.
Are you a smoker?
Yeah.
Very much?
About half a pack a day.
How long have you been doing that?
About 3 years, 4 years, off and on.
And how old are you?
18. But I don't smoke during the daytime. I always smoke at night.
Are you thinking of quitting?
Yeah, well, I quit during the summers usually. I used to for football to get in shape, and it's just kind of a habit.
Are you thinking of quitting permanently?
No, I think it does you some good. You know?
For example?
Well, some people are nervous, you know, and you'd be making noise and twiddling around, and cigarettes sometimes relieves that, at least for me. It makes me feel more at ease. It's probably just insecurity or something, like sucking your thumb, but if it helps, why not?
41-year-old Pat Corns is a former waitress and bartender. She smoked a pack and a half a day in addition to being around lots of other smokers in their smoke for 28 years. She is being treated for respiratory failure, chronic bronchitis, and emphysema. Her medicine is 24 hours a day of oxygen. Patricia's oxygen is supplied by a concentrator which looks like a piece of furniture. Ample plastic tubing enables her to move freely around the house, and when she goes out, she carries portable oxygen with her. Oxygen for Patricia costs about $200 per month. She is paying to breathe.
She's on the oxygen 24 hours a day. She does not absolutely have to have it every minute of the day. There are short periods of time that she may be off the oxygen. The oxygen mainly is to prevent the deterioration of the body and other organs from the lack of oxygen from her lungs. The x-ray here shows that the diaphragms are low. They're not particularly flat. The heart is thin and in the midline, and the patient is somewhat thin. This is common in chronic lung disease because it requires so much energy to breathe.
I was doing Christmas shopping, and what it was is I happened to be up in one of the stores in Northland, and all I did was walk out in the mall, and I thought, gee whiz, I didn't even have any walk, you know. I didn't even have any packages with me yet, you know, just my handbag. And I thought, how am I going to do this Christmas shopping? I'm really out of breath again. And I was using this like inhaler, you know. And I was almost dependent on that inhaler a lot, in which they really didn't want me to do that because I was dependent on it too much. And so I was up there, and I was really having a bad time. So I really had to turn around and not go shopping. I had to come home. I swear that what I think about is how bad I was when they called the emergency squad that day. Yeah, I was bad because I was on my way to work, and I was in my car, and I had that turnaround out there in the back. And how I got back in the house, I didn't even know I was really that bad. I mean, it took me like 2 hours to get dressed that morning. And all I had was a pair of like green slacks on the top, and I was really trying to get ready for work. And because I'm not one to, you know, lay off work and, you know, go in, you know, just dragging in there. But then I was glad I really didn't, because I probably would have either had an accident with my car or something. And,
So
it
you
wasn't
mean
worth it.
you mean you had started to go to work?
I was in
your
my car
Yeah.
when I really had the attack, and I finally just...
What was it like?
What was it like? Drowning or smothering, like somebody... Best thing I could say is if somebody took a pillow, put it over my face. I don't even know how I got in the house. That part of it I do not remember.
In looking at the rest of the family, how many other members smoke?
Well, my husband and my son.
This is not enough for them to see you like this, to have them quit?
Well, someday, because I figured that I said the same thing, but nobody could tell me either, you know?
Did you think it would happen to you?
Pardon?
Did you think this would happen to you?
Oh, my God, no.
After 35 years of smoking, Betty Stillwagon had one of her lungs removed 4 years ago due to lung cancer. She's now 60, and although she seems to be well, she leads a confining life since she has emphysema in her remaining lung.
On this chest x-ray, this is the normal lung. You can see over here that the lung has been removed. It's filled up with fluid that becomes scar. All of these clips are where the arteries and veins and bronchial tubes have been clipped off to the right lung. And so she has no lung on this side. On this one, it should look like this, or at least look like this side. And her heart which is normally here, has shifted over here so that you can't see it hardly at all. This is the only lung she has left. She has emphysema here, but there is no evidence of recurrence of tumor. Emphysema is a lung tissue or a lung that has lost the elastic support. It's not much different than if you blow up a balloon too many times and it becomes, instead of a very tight balloon, hard to blow up, very floppy, that it takes very little breath to blow up. The lung is really then a series of over-distended air sacs. The symptoms of emphysema are shortness of breath. They may have some cough, and they may cough up some sputum, and they may have some wheezing. But the most prominent symptom is shortness of breath. You've literally run out of lung.
From leading an active life as manager of a clothing store for some 16 years, she now does not like to leave her ring of security.
I don't like to travel because I don't like to get away from what you would probably call my ring of security. The doctor, my husband, my home, my oxygen. I do have a note in my purse that says that to give me oxygen if I need it. But sometimes if you get to some place where they don't know you and you maybe have a spell, why you don't feel secure, it's when you're home with your own doctor and your own hospital and your husband. The last spell that I had, I got into the oxygen and I had to yell for my husband. He came and put my robe around my shoulders and dried me. I couldn't do it. I had to get there fast because I think you're scared, and the more scared you are, the harder it is for you to breathe. But I love to take care of my grandchildren, and it's hard because I get too tired. And they're getting a little older now, so, you know, it's a little better. But you love to pick them up, like my granddaughter's only 2.5. You just love to pick her up and give her a squeeze, but yeah, I can't do that. If I do, I get tired.
Jim Moreland is 42 and dying of lung cancer. It was discovered the summer of 1979, and the upper lobe of one lung was removed surgically. During surgery, it was discovered the cancer had spread. A former carpenter, he has not worked since last summer.
I think my heart stopped for a little bit. It just, I don't know. I just figured that was it. Right away, you know. Lung cancer is bad. But I just, pardon me. I just figured that was it. Because, and then when he told me that, I said, how bad is it? And he said, just as bad as it can get. Of course, I'm glad. They tell you outright here.
The tumor absolutely has involved the nerves in his chest, the lymph nodes in his chest, and have progressed forward and involved his bone. So he has multiple symptoms, and the symptoms of hoarseness, pain in his back, and weakness, I'm sure, are related to this advancing. Jim lived very well for eight months. And a month ago, he began to demonstrate a number of signs of progression of his tumor. The first was some pain and sensation of fullness in the middle portion of his chest. And when we did an X-ray, we noted that the chest, which had previously been fully expanded, had now demonstrated an elevation or rising of his diaphragm muscle at the base of his right lung upwardly, this compared to the left. And the area that was once clear is now hazy. Additionally, further studies demonstrated that he had erosion of bone. And we note that the bone that was eroded was a couple of his ribs. They demonstrated a moth-eaten effect. Additionally, he began to lose the strength of his voice and began to squeak with a very hoarse voice. And a special x-ray demonstrated that he had tumor which spread further into the center portion of his lung. And the tumor most probably involved the nerve which we call the recurrent laryngeal nerve, a nerve that exists on the both left and right side that goes upwardly up into the voice box and regulates the larynx, our voice box. And on examination, he demonstrated a paralysis of his voice box muscle on the right side. The mean survival time for a patient with stage 3 cancer of the type that Jim has is approximately 1 year. And that means the average 50% of the people with this type of tumor have a life expectancy of 1 year.
After diagnosis.
After the diagnosis has been made, right? The time that the diagnosis is made is when we determine how long the patient's survival is expected.
And where does the 2 months fit in?
When we look at the situation now, we're approximately 9 months down the road. And we're talking about, in Jim's situation, where he has involvement very close to his great vessels, that the average expectancy at this point is approximately 2 months. He has been on chemotherapy from the completion of his radiation therapy in September of 1979. He's been treated with chemotherapy up to this point, and he has done very well. All our studies have shown stabilization up until these last few weeks.
I took 5 chemotherapy treatments. Got sick after every one. Very, very deathly sick for 4 or 5 hours. I would just do nothing but just vomit and dry heaves and all that. And then after that, I would have no appetite, very little appetite for 3 or 4 days and just be really punky.
We are now treating him with radiation, additional radiation, mainly because the tumor has also spread itself very close to the main blood vessels of his body. The main vein which returns the blood to the heart has been pressed and compressed by the tumor, and we need to shrink this down because if you might note on him, he has some puffiness.
There's really nothing to it. I mean, you just get under a machine, and they got you marked out where the beam is going to hit. You see nothing, you hear nothing, you feel nothing.
What do you think about when you're in there?
Wondered if it was going to really help me. Didn't know what my future was going to bring. Worried about my family all the time. And now, well, like I said, my family and I, we did things together. You know, we tried to keep as occupied as we could. We go to movies once in a while, you know, and go to friends. I have a 10-year-old boy that keeps me kind of occupied. He's great. That's about it. Another thing, my wife, we do things together.
If given the chance to start life again, would Patricia, Betty, or Jim smoke?
It is not worth it.
No way. No.
Goodness, no. No, you couldn't get me to go near anybody with a cigarette if I knew what I knew now. Because I'll tell you, smoking cigarettes is a waste of health and a waste of money.
The 10th anniversary of the Women's March for Equality. And in order of that, we begin tonight a series of reports with Qube reporter Lorrie Secrest, who talked to women who have traditionally male jobs. Now, tonight's topic is particularly appropriate because Lorrie discovers that it's not always the man that holds the reins.
When you first start out, men don't trust women. You know, it's like we're supposed to be, I don't know, they think we're lower than them, or we're not as strong as they are, or what it is, but a lot of men don't trust women with their horses, and it's tough to get a stable going, you know. But I think if you can show them that